Dr. Wendy here with Empowered Life PC. Today I want to go over a common thing, especially for those that are seeing a home birth midwife. They have a lot more connection with their provider in finding out that the baby's head is sitting on top of their pubic bone. There is an exercise that I recommend for those women to do in order to help be able to get the baby off the pubic bone and better centered into the pelvic bowl. So to do that, it's going to be what we call a wall squat, basically. So what you're going to do is you're going to have your bum and your back against the wall and your legs kind of out at almost a 30 to 45 degree angle, and your feet shoulder width apart. Okay? Now, the reason the baby more than likely is on top of your pubic bone is because our pelvis is tilted forward, which means that pubic bone shifts down and it kind of closes off, if you will, a little bit of the birth canal area. So one of the things that we have to do to get set up correctly to do this appropriately is to work on my back right now, because my pelvis is tilted. When my upper back is against the wall, but my low back isn't. So we're going to tilt our pelvis to where we kind of bring our lumbar spine flush with the wall. Okay, that's step one. Step two then is to take your hands and gather it up underneath the base of your belly. You should be able to feel that your pinkies are basically resting on top of your pubic bone. So from here, you're going to take a big deep breath in. And then on that breath out, you're going to go into a squat. As you are breathing outward and squatting down, your hands are going to lift up and push in. This is to try and help lift the head up a little bit off the pelvis or the pubic bone and kind of push, putting pressure on to kind of help the baby get more engaged. Now, as you're doing a squat, this is opening up the pelvic floor, opening up your pelvis. It's taking all the tension off. You may even feel that your womanhood area down there is opening up. That is exactly what we want. And as you're applying that pressure, because all that is opening, it gives a better availability for the baby to kind of hopefully be able to shift back into its position and get more engaged, if you will. All right, so this is what it looks like looking at whole. So we're going to tilt basically work on bringing that pubic bone up, putting our lumbar spine flat onto the wall. Going to overlap our hands, have those pinkies be right there where that pubic bone is. Deep breath in. And on that breath out, we're going into a squat. We're pushing in, pulling up and pushing in, and you come down. You let go. Kind of support yourself, push up against that wall to come back up, and then we repeat. So I'm going to do it this time without explaining. And you would do that for 3 or 4 breaths, and then stop. You can end up doing that several times throughout the day, but you never want to do it more than 3 or 4 breaths